For this TED Talk case study, we looked at community mental health and the high turnover rates that happen with employees who are there. We looked at this because it's a shared administrative problem within the community health. And in particular for Marion County Youth and Family Services, it's not just an inconvenience. It affects the continuity of care, increases the strain on staff who remain, and makes a long-term program that much harder to staff and maintain. It's also incredibly expensive and difficult to work around as well. So, in particular, we studied it through the eyes of the program director for Youth and Family Services, Sid, and through interviews with him, discussed the situation, his approaches to handling the problem, how he wants to move forward, and what that looks like. As we dug into the interview and began to look at what the problem identification areas are, we began to see that there's huge impact across the board that disrupts continuity of care for the clients. So clients who have been with a clinician for a significant amount of time then find themselves needing to go to a new one and starting all over again. It does increase the strain on remaining staff because they have to pick up those clients. It weakens team cohesion and morale. I mean, people are just gone and no one really knows why, and there's tension to it. Or they say, "Oh, well, let me tell you why." And so ultimately, it does make long-term program stability flexible. And what drives it is there's just a lot of high stress and pressure in general, also because there's a lot of change and turnover. There's low morale and staff discrepancies, disconnections that the clinicians don't feel fully supported. And in particular, oftentimes feel like they're given clients that have problems that are beyond their skill set, which creates a sense of frustration and kind of disappointment. There's also a lack of early feedback channels. So if something does happen or something comes up, it's hard to communicate that. And there's actually few wellness and retention plans. There's not a whole lot done to make that system easier. So, looking at the situation from Sid's perspective in his case, it reveals a couple things. One, he himself is new in his position. He's been there less than a year and is just kind of starting to find his voice. He does bring real strengths to his leadership, however. He is humble, he's very service oriented, he's willing to work hard, and he is invested in helping the staff grow. He's begun clarifying expectations and he's improving supervision and making consultation more useful for the staff that do work with him. But the case also revealed a huge gap in that he's not real intentional about structured support. It's present mostly through his personal leadership style and not through a formal system. So in that sense, there's no real, you know, feedback process that's clearly laid out. There's no structured wellness support and no proactive way to identify retention concerns before staff leave or when things become an issue. So it's hard for people to figure out where they're supposed to go with their issues. So this means for the organization is how can the organization help build that structure in and help both train SID and then put policies in place to provide opportunities for this feedback that is needed. It's clear that the issue is not that SID doesn't care or a lack of commitment, but it does show us that caring leadership by itself is not enough in a high demand public health, behavioral health setting. The organization needs to improve retention. And in order to do that, they need to move from being informal and, just interpersonal leader driven to have more intentional structure built into the program overall. So this is what led us to the two recommendations that Callie's about to walk us through and explain from her perspective.
Okay, so jumping into the evidence-based solutions, we did find an article that was from the Mental Health Journal, and it identified that high turnover rate is especially prevalent in younger staff under the age of 29. And within this study, they did find that this particular population expressed that the majority of their workplace dissatisfaction revolved less around their salary or how much they were making and more around a lack of work-life balance and a lack of connection to coworkers. So, with this particular aspect of our problem identified, we proposed two main solutions. So, the first solution was to facilitate peer support within the workplace. So, one of the articles that we found highlighted an intervention in which small stress management groups are created within the staff. They meet once a week for about an hour to an hour and a half a week, and they are staff led and staff directed. So this can promote coworker relationships, collaboration, a sense of belonging within the organization. It can also aid in transforming the culture of the organization to being more self-care and wellness focused for the staff, identifying strategies within the group of how to find a better work-life balance. And tying it all back to the inclusive leadership theory proposed by Nordhaus, this transformation in organizational culture can facilitate a higher sense of individual commitment for staff. So, like the staff member buy-in into the organization, because it facilitates this collaborative sense of community and connection and relationship building amongst coworkers, and even between leadership and staff members. And so this will all yield to a decrease in turnover rates. Then the second proposed solution is to promote participatory organizational development. What does this mean? It basically just means bringing in staff on major changes within the workplace. So the I guess, facilitation of this idea is to have whole member staff meetings. So everyone is invited to these staff meetings. They can be weekly, they can be bi-weekly, they could even be once a month if needed. And engaging the staff in problem solving and the overall growth of the organization. By doing this, we can give staff a platform to not only provide feedback, but also be included in the decision making and finding solutions for organizational difficulties. This inclusion and participation allows for the fostering of a more collaborative spirit amongst staff and leadership. Everyone is working together for a common cause, which is the success of the organization. It also improves the sense of community and that idea of a shared identity within the workplace. We are all in it together. That separation between powers of management and staff and lower staff is, really alleviated. Additionally, this structure allows for clinicians' needs to be expressed and heard. Within these staff meetings, when there is a difficulty or say, you know, um, documentation expectations are too high. We can't get them in every 2 days. We need some extra time. These staff meetings provide a platform where clinicians can express these concerns and seek solutions and validation from their leadership. It all kind of comes down to a sense of community that results in a decrease of the rate of dissatisfaction and isolation, and then decreases high turnover rates. Okay, so in order to implement these solutions, there are some skills that leaders need to have in order to facilitate these solutions. Particularly in regards to our leader B, Sid, there is some development that he needs to undergo. Primarily, that development is all kind of tied into the ideas of supportive and transformational leadership. So, with supportive leadership, the focus is really on the overall well-being of the staff, as opposed to meeting expectations and goals and all that. So, our leader B must develop the skills of empathy, active listening, promoting empowerment and recognition of his staff. And this is particularly tied into the staff peer groups where empowerment becomes really important because it is staff led. So leader B needs to develop all these skills and then learn how to teach his staff members to grow in the same areas. On the transformational leadership side, Sid needs to focus on the engagement of his staff and creating those meaningful connections. Within this, he'll need to highlight his communication skills, creative thinking, his vision, his integrity. particularly when it comes to promoting that participatory organizational development. He has to learn how to collaborate with his staff, elicit feedback and problem solving, and raise the overall motivation and morality of the staff.
So in the end, our project reinforces that turnover is not just about a staffing issue. It affects the organization on multiple levels, from the clients to the morale of the clinicians to the strength and familiarity of the leadership itself. It reflects that staff need to feel heard and supported and equipped to remain in the work that they're doing over time. So in Sid's case, I mean, we saw genuine care and concern for the clinicians, and he definitely cares for the organization, but we also saw that just being caring is not enough, and that there needs to be internal supports built into, particularly an high stress organization like this. So, our recommendation would be that Marion County strengthen retention by building more intentional systems for both staff feedback and their wellness, as well as shared problem solving. Our hope is that these changes will not only reduce turnover, but also help create an environment that is beneficial for the organization, for the staff, for the leadership, and ultimately for the clients. So thanks for listening.